What really causes cancer? 10 myths and risk factors you must know. What really causes cancer? Is it sugar, stress, cell phones, family history, or is cancer something that happens completely randomly? Every day, millions of people search for answers about cancer causes, cancer symptoms, cancer prevention, and cancer myths. But the internet is full of confusing information. Some people say one food causes cancer. Some say stress causes cancer. Some say phones, deodorants, or microwaves are dangerous. Others believe cancer is always genetic, or that nothing can be done to reduce the risk. So today, we are going to separate cancer myths from real cancer risk factors using simple 3D medical explanations. Cancer begins when normal cells develop changes in their DNA. DNA is like the instruction manual inside every cell. It tells the cell when to grow, when to divide, when to repair itself, and when to stop. When DNA becomes damaged, the body often repairs the mistake. But sometimes, the damage is not repaired correctly. If a damaged cell keeps growing and dividing when it should not, it can slowly form a group of abnormal cells. Over time, these abnormal cells may become cancer. But here is the important point. Cancer usually does not happen because of one single thing. Cancer is often the result of many factors working over time, including age, genetics, lifestyle, infections, environment, and random cell changes. Now let's look at the biggest cancer myths people search for online. Myth number 1. Sugar directly causes cancer. This is one of the most searched cancer questions. The truth is that all cells in the body use sugar, or glucose, for energy. Cancer cells also use glucose, but that does not mean eating sugar directly creates cancer. However, too much sugar can lead to weight gain and obesity, and excess body weight is linked with a higher risk of several cancers. So the real message is not that sugar magically creates cancer. The real message is that a balanced diet and healthy body weight matter. Myth number 2. Stress causes cancer. Many people worry that emotional stress, sadness, or negative thinking can directly cause cancer. Stress can affect sleep, appetite, immunity, and lifestyle choices, but there is no clear proof that a person's attitude alone causes cancer or makes cancer spread. This is important because people with cancer should never be blamed for their illness. A positive mindset may help someone cope, stay active, and feel supported, but cancer is not caused simply because someone was sad, worried, or stressed. Myth number 3. Cell phones cause cancer. This is another very common fear. According to current evidence, cell phones have not been proven to cause cancer. Cell phones emit low-frequency energy, and this type of energy does not damage DNA in the same way as strong ionizing radiation. That does not mean we should ignore all radiation risks. Ultraviolet radiation from the sun and ionizing radiation at high levels can increase cancer risk. But everyday cell phone use is not considered a proven cancer cause based on the best studies so far. Myth number 4. Cancer is always inherited. Family history can matter, and some people do inherit gene changes that increase their risk of certain cancers. But most cancers are not directly inherited from parents. Many cancers happen because of DNA changes that build up during a person's lifetime. These changes can be connected to aging, tobacco smoke, radiation, infections, chemicals, or other environmental and lifestyle factors. So if someone in your family had cancer, it does not automatically mean you will get cancer. But it does mean you should talk to a doctor about your personal risk and whether earlier screening is needed. Myth number 5. Only smokers get cancer. Smoking is one of the strongest known cancer risk factors, especially for lung cancer. But cancer can also happen in people who have never smoked. Cancer risk can be influenced by many things, including alcohol, infections, obesity, air pollution, sunlight exposure, occupational chemicals, and genetics. Still, avoiding tobacco is one of the most powerful steps anyone can take to reduce cancer risk. This includes cigarettes, vaping products with harmful chemicals, secondhand smoke, and chewing tobacco. Myth number 6. If there is no pain, there is no cancer. This myth is dangerous. Many cancers do not cause pain in the early stages. Some cancers grow quietly for a long time before symptoms appear. That is why people should not wait for severe pain before getting checked. Warning signs can include unexplained weight loss, unusual lumps, bleeding, changes in bowel or bladder habits, persistent cough, difficulty swallowing, extreme fatigue, skin changes, or a sore that does not heal. These symptoms do not always mean cancer, but if they last for weeks or keep getting worse, they should be checked by a doctor. Myth number 7. Every lump is cancer. Finding a lump can feel scary, but not every lump is cancer. Many lumps are caused by infections, cysts, benign tumors, inflammation, or hormonal changes. But a new lump, a growing lump, or a lump that feels firm and does not go away should never be ignored. The safest step is medical evaluation. Early checking does not mean you are afraid. It means you are responsible. Myth number 8. Herbal remedies can cure cancer. Natural products, vitamins, herbs, and alternative remedies are often promoted online as cancer cures. But no herbal product has been proven to cure cancer. Some supplements may even interfere with chemotherapy, radiation therapy, or other cancer treatments. This is why people should always tell their doctor about any herbs, vitamins, or supplements they are using. Healthy food can support the body, but it should not replace professional cancer treatment. Myth number 9. One superfood can prevent cancer. You may see claims that one fruit, seed, drink, or diet can completely prevent cancer. The truth is that no single food can guarantee cancer prevention. But an overall healthy eating pattern may help lower risk. A balanced diet with fruits, vegetables, whole grains, fiber, and less processed food supports general health. Limiting processed meats, avoiding excessive alcohol, staying active, and maintaining a healthy weight are more realistic prevention steps than depending on one miracle food. Myth number 10. Cancer cannot be prevented, so lifestyle does not matter. This is also false. Not all cancers can be prevented, but many cancer risks can be reduced. Research shows that a large portion of cancer cases are linked to preventable or modifiable risk factors. These include tobacco use, alcohol consumption, excess body weight, physical inactivity, ultraviolet radiation, air pollution, and certain infections. Prevention does not mean perfect protection. It means reducing risk as much as possible. Now let's talk about the real cancer risk factors that people should know. The first major risk factor is tobacco. Tobacco smoke contains chemicals that can damage DNA and increase the risk of many cancers. The second is alcohol. Alcohol is linked with several cancers, including cancers of the mouth, throat, esophagus, liver, breast, and colon. The third is excess body weight. Obesity can affect hormones, inflammation, and metabolism, which may increase cancer risk. The fourth is physical inactivity. Regular movement supports weight control, hormone balance, immune health, and overall body function. The fifth is unhealthy diet. A diet high in ultra-processed foods and low in fruits, vegetables, and fiber may contribute to long-term health risks. The sixth is ultraviolet radiation. Too much sun exposure and tanning beds can damage skin cell DNA and increase the risk of skin cancer, including melanoma. The seventh is infection. Some infections can raise cancer risk, including HPV, hepatitis B, hepatitis C, and Helicobacter pylori. Vaccines, safe practices, and medical treatment for infections can help reduce risk. The eighth is air pollution and harmful chemicals. Some workplace exposures, indoor pollutants, outdoor air pollution, asbestos, and other chemicals can increase cancer risk over time. The ninth is age. Cancer risk increases as people get older because DNA damage can build up over many years. The 10th is family history and inherited genes. Some people are born with gene changes that increase cancer risk, so family history should be discussed with a healthcare professional. Now the most important question. What can you actually do? Do not use tobacco. Limit alcohol. Maintain a healthy body weight. Stay physically active. Eat a balanced diet with more fruits, vegetables, whole grains, and fiber. Protect your skin from strong sunlight. Get recommended vaccines, such as HPV and Hepatitis B vaccines when appropriate. Follow cancer screening guidelines based on your age, sex, family history, and doctor's advice. And most importantly, do not ignore symptoms that continue for weeks. Cancer awareness is not about fear. It is about knowing what is real, what is myth, and what steps can actually protect your health. The truth is simple. Not every cancer can be prevented, but many risks can be reduced. Not every symptom means cancer, but persistent changes should be checked. Not every online claim is true, but science-based information can help you make better decisions. If this video helped you understand cancer causes, myths, and prevention, like this video and share it with someone who needs clear health information. For more simple 3D medical explanations about cancer, symptoms, prevention, and treatment, subscribe to this channel. This video is for educational purposes only and should not replace professional medical advice, diagnosis, or treatment.